Hello, and welcome, all of you respite people across the nation. I'm Susan Summers. I'm with Arch, and I've been coordinating this initiative for the last 5 years, and I'm thrilled to share information about it. I love this work, and I've learned so much from programs across the nation. So I'm hoping that you'll have enough information to decide whether or not you would like to apply on behalf of your program for recognition, and I'm hoping to get inspired a little bit. So let's get started. Okay, so for those of you who don't know about Arch, a little bit of background. Arch sponsors the Innovative and Exemplary Respite Practice Initiative, but Arch does a whole lot of other wonderful things too. The National Respite Locator, the National Respite Coalition, which is the policy division, lifespan respite technical assistance and resources. That's one of the things that I work on. I think about Arch focusing broadly on respite access, information, education, and advocacy. We're big on that, and supporting quality services. And the supporting quality services is where the Innovative and Exemplary Respite Practice initiative fits in. Sometimes I think like we're the sort of clearinghouse that sees the picture of across all the states at the systems level. And with this initiative, we have a better understanding of what's happening in communities in terms of direct service practice. So, and we also, I think, are really strong on connecting people. Okay, so what we're going to do today is talk precisely about this initiative. It was established 5 years ago to identify promising practices across respite settings and to learn more about respite services that are evidence-based or informed. So if you think about respite and the definition of lifespan respite, it's inclusive. So it's not just early childhood, it's throughout the lifespan, and it's all ages. And so I come from an early childhood special education background. We have a consensus about what best practice means. Because respite is so diverse and so inclusive, and there's not much research to support specific practices, we want to understand it in its entirety, to learn ways of addressing challenging aspects of providing respite to special populations. And last but not least, we want to honor the work of innovative and exemplary programs across the nation. So, because respite is diverse and inclusive, as I said, research-based evidence is limited. So we've developed criteria for selecting programs. I'm going to go over those criteria in a moment. But one of the things I think that's been important from my perspective doing this initiative the last 5 years is that part of the selection process is we're not evaluating programs. We want them to meet certain criteria that's consistent with this framework, and we want to learn about that. So respite is a bit of a black box because of the diverse models. We want to learn about your programs. We also want to learn from your programs. So one of the ways we do that is to look at your program documentation. Any evaluation data you have, it could be outcome or it could be process measurement, we hope, or performance measurement. We hope it's both in programs. And then we really are interested in the insights that you have. And I'll tell you about the process of applying and how your insights are really important in that process. So there have been two kind of offshoots from the Innovative and Exemplary Evaluation Project, Innovative and Exemplary Respite Initiative. And the first one is the evaluation project. We're just wrapping that up right now. So for the past year, 4 programs across the nation have been meeting and conducting evaluation on the respite programs in real time. The programs represent various populations, age groups, models, and areas of the country. And one of the things we focused on is caregiver wellness, because of the definition of respite, that we are giving care to a caregiver's, we're providing care to a caregiver's loved one, but we want benefits to, ideally, to accrue to everybody in the family, but mandatory is that the caregiver get some benefit from respite. And then the second offshoot is conversations on caregiving. These were 4 conversations with respite programs that were recognized as innovative and exemplary. This particular series focused on university and college-based programs, but some of the things they talked about apply to all respite programs. And one of the things that stood out for me is how to support students and volunteers, because workforce is such a big issue. There's some really edifying and enlightening lessons that we've learned from that podcast series. And it also gives you a feel for the programs. It's just really good series. Okay, so today what I'm going to do is really practical. I want to describe the 7 qualities and characteristics of programs and services that make them exemplary or innovative. And I want to provide some real life examples so you'll kind of get a feel for what those programs are like. Okay, so as I mentioned, this initiative has existed for the last 5 years, so this will be the 6th year. You'll see a link on the top of this slide, and there'll also be one in the chat that will take you to this page so you can learn more about it. And there's another link. So one of the most important things to pay attention to if you're thinking about applying for recognition is this pre-application checklist. So there are 3 things that we're looking for. We want to know that you've been in operation for at least 3 years. Most applicants have been in operation far longer than that, but we have had one program that was just at 3 years, and it was so strong. We did recognize them as innovative and exemplary. The reason we want you to have been in existence for at least 3 years is we've learned that there's that early phase respite programs have a lot of growing pains and are often struggling with stability of resources and model focus. So they're usually just not together enough for us to be able to assess whether or not all those 7 criteria are met. The second thing that is important to have before you fill out the application are some written guidelines for your respite service, or a program or operations manual that you would be willing to share with ARCH. And for those who are in a position to be able to replicate your services, to be willing to talk to other programs and to ARCH about that process. So this varies for programs, but we need some documentation for what you do. Some people have like these magnificent program manuals. Probably more programs have a list of all the protocols and processes they use within the program. And then the third thing that you must have is some sort of written plan for how you'll measure performance, or you may have a logic model for measuring performance. So it can be relatively simple. And again, some programs we've recognized have had outside evaluators, and they really have all their ducks in a row in terms of evaluation. Others are at a more beginning phase of evaluation, but they're collecting data on the population they serve, on caregiver experiences of respite. Some may be simple outcomes. So have some measurement processes in writing before you apply. Okay, so this respite, I've got to hide my, For the purposes of this application, respite is defined as planned or emergency care provided to a child or adult with special needs in order to provide temporary relief to family caregivers who are caring for that child. So the reason it's important to include this is that we've had some models that actually didn't quite fit this. Some programs submitted an application. So make sure you actually are providing respite. That means the caregiver is getting some relief either through someone caring for their loved one, or in some programs through shared respite, but in a model where the caregiver is still really getting time away from caregiving. Okay, here are the 7 selection criteria. An evidence-based or informed approach, written plan with goals and objectives, program or service manual or guide, person and family-centered services, professional development plan, evaluation data plan, and sustainability. So this is the criteria checklist, and actually I want to just talk about what happens when you apply. So we look at the pre-application first, and then you fill out the application online. I think it takes a couple hours for programs all told. Most programs can cut and paste responses to the sections. And this criteria checklist maps on to the application. So this is what we use to organize ourselves when we're reviewing the application. We go through the criteria. And then for those programs that meet all the 7 criteria, we schedule an interview with your program. We say it takes between 30 to 60 minutes. I don't think we've ever done a 30-minute one because the conversations are so rich. I feel like we really make friends during that process. Then we summarize the data, and an outside review panel works with ARCH staff to decide if a program is recognized as innovative and exemplary. Okay, so let's talk a little bit more about those criteria. So an evidence-based or evidence-informed approach is guided by research data and knowledge and wisdom gained through practice. And this is really important for respite programs because, as I mentioned, in my background in early childhood special education, there are whole curriculums that you can use whole cloth to do an early intervention program. With respite, it's lifespan across the ages, it's special populations, it's lots of different illness and disability conditions. So there's not a big inclusive research base. So we know a little bit about what doses work. We know a little bit about time use coaching, but the programs that we've explored in depth, those 42 programs, innovation is really key in those programs. And they'll have pieces of evidence-based, or they'll borrow from other disciplines. But when you do that in your program, it's important to collect data from your program as you go to inform you as you go. So that's what we mean by evidence-informed. Then the written plan with goals and objectives clearly articulates your program's outcomes and performance targets. This is really important. Your goals and objectives directly relate to your program's stated mission, and those goals and objectives inform data collection efforts. So these things are all linked. So if you do you have this really beautiful program model, but you're only collecting client satisfaction data, that's not mapping on to your overarching goal or your targeted outcomes and performance measures. So that that written plan needs to be fairly comprehensive. And then the program or service manual and guide connects outcomes with activities that led to them. So a detailed manual is a guide necessary to check fidelity to a program's model. So you say you're doing these things. How do you know you're doing them? Well, you have them written down and you periodically check them to make sure they're happening as you anticipated. And then for replication, we've had some programs that have actually replicated their program across different sites within a state or community. We have other programs that are working with programs outside their community and with other states to replicate. And because the programs differ in complexity, we don't expect that every program that's recognized as innovative and exemplary will have enough information just to hand it over somebody to replicate. But we do want that documentation so at least portions of the respite service could be understood and tried by other programs. Then person and family-centered services. So this is a concept that originated in nursing, and it's defined by a collaborative approach to planning, delivering, and evaluating services. This kind of is we've discovered through those 42 programs, this is sort of the meat of respite. So it's not just the time that the person with an illness or disability is in care. It's really relationship based. You work with caregivers. We want to know what that looks like in your program. So not only what you do, but how you do it. So this one's really key. Okay. And then professional development training. We want to know, or planning, we want to know that you actually have a plan to recruit, train, support, supervise staff and volunteers so that they're competent, they're confident, they provide safe and effective services, they know all the programs, policies, and protocols. This is an important part of a program guide. And it's been really important, we've discovered in programs because of workforce issues. So many of the programs we've talked about have talked about staff shortages, about different things they're doing to encourage staff retention. We've had discussions with programs that talked about making the respite experience as good for the volunteers and for their staff as for the families. So that focus on making a really socially warm, supportive work environment. And the podcast series I mentioned before, those the people we interviewed really talked a lot about that. So that's there's some really important information in there. Excuse me. And then program evaluation and data collection measures program implementation. Did you do it with fidelity? Did you do it as intended? Consumer satisfaction. Because of this evaluation project I mentioned, we're looking more closely not just at satisfaction, but caregivers' experiences throughout the process of receiving respite and interacting with your program. And really importantly, person and family-centered outcomes related to individual and program goals. And this was just a sweet example. This is from Child Serve Respite. And so a program staff member facilitates this satisfaction survey with children who have participated in this group respite girls weekend. So the child does not have to be verbal. They just thumbs up, I don't know, thumbs down, or you could even read the expression from the child's face. And this actually doesn't constitute a comprehensive program evaluation data collection, but we loved it because of the way this program thought about trying to really understand how their program's working for everybody who's involved with it. And that could include evaluation from your staff and volunteers if that's an issue and you're trying to focus on improving staff and volunteer experiences, we're really interested in how programs think broadly about program evaluation and data collection, or it could be completely sophisticated and have an outside evaluator doing enhanced evaluation or research on top of the basic evaluation that you do in your program. And that looks at population, that looks at dose, how much respite folks get, that looks at program fidelity, that looks at caregiver and care recipient experiences, and that looks at outcomes like reduction in stress or caregiver burden. So the more that you do, the better, of course, but some programs are at earlier stages and they just have the basics, and that's fine too. So don't worry if you don't have a comprehensive evaluation, but have some measurement processes in place. One of the things I think that happens through this process is that there are programs who don't quite meet all criteria, but they're so stellar in other ways. We have designated a few programs as rising stars, and we've worked with some of those programs to meet all the 7 criteria. And there's when we recognize the program as innovative and exemplary, that recognition lasts for 3 years. But if your program changes significantly within that time and you're a rising star, we can work to designate that program as innovative and exemplary. And then finally, sustainability. We're looking at stability of the program over time, shared leadership, diversified resources, and a written plan. Many programs have a written sustainability plan or a written strategic plan, and the strong programs tend to have a board that they work with overseeing sustainability. So those were the 7 criteria. Here's the link, and it's in the chat also, to apply online. Deadline is October 8th, 2024. And let's open it up to questions. And let me see your faces if I can. I'm going to stop sharing here for a minute so I can see everyone. Okay. Hello, people. It's nice to see everyone there. Ah, there's Kate. Let's see if I see anybody else I know. Okay. You don't necessarily have to raise your hand, but you can do that if you want to. Jump in and tell me what you're thinking, what you're worried about in terms of like time applying. Anybody want to know what they get out of it? That's a question that we usually get. I'll tell you, we at Arch and the whole network gets more out of this than you do probably. The generosity from programs in sharing their knowledge and expertise and supporting other programs, presenting in national conferences. Some of the programs have gotten involved with ISBA, which is the international group. So this is a real, there's a lot of reciprocity and a lot of generosity. Okay, Debbie, let's see. Let me just look at chat.
I can read you some of the questions, Susan, if that's helpful.
Okay, yeah.
We did have one question, if this application process is available every year, and will there be a 2026 application? And I responded already in the chat, but in case some of you haven't seen that, we fully expect to offer it annually, but Arch is also dependent on annual congressional appropriations. So as long as we're funded and we're here, we will be offering an annual call for applications. We're planning to at this point, yes, in time. The next question was, how many programs do you identify each year? And I can let you take that one, Susan.
It really varies. We receive fewer applications each year. So I think last year we had 6 that we recognized. I think the most we recognized was like 13, maybe. I'd actually have to go back and check. But if you're when we do that first review, well, let me just say this. If you pay attention to those 3 questions, whether or not you've been in existence 3 years, whether or not you have some materials that we can look at that support your program, and whether or not you do some sort of evaluation, that if you don't meet those criteria, save yourself time. On the other hand, if you don't meet those criteria and you would like to kind of work on these things independently, outside of this initiative, you can still call me. I'll share all the information that we have and give you all the support I can if you want to get there for a future application. I don't think the application is too onerous. I haven't heard that from people. I think people actually get kind of excited, kind of putting down in its entirety all the wonderful work that they do. And the actual interviews that we have with programs are kind of love fests. I feel like I know that I've made real friendships actually as a result of just going through this process and getting to know one another. So if you're thinking about doing it, it's pretty painless actually to do it.
We also
And
had
so
a question about whether there was a fee to apply.
no fee to apply. Sweat equity, just your hard work filling out the application and gathering all the information about your program in one place. That can be a bit of work. So, anything else?
We have a question about the definition, care provided to a child or adult with special needs, and what is the definition of special needs?
Special needs is any health or disability condition. It's global. Jill, you can help me out here too, but
Well, it's even broader than that because we also include family members who might be vulnerable to abuse or neglect or other, if an emergency type respite situation where the person in care doesn't necessarily have a disability or a chronic condition, but the family has a special need for extra support. For
right.
example, we've recognized several crisis nursery programs that don't always require that the person or the child in care have a disability or chronic condition.
So that's a big oversight on my part because that's how I became involved with respite in the 1980s as a director of a crisis nursery program. So that is really important. We have some wonderful crisis nursery models.
Okay, thanks. That was my question. That's what I needed to hear because that's what we do. We do crisis respite.
Oh, wonderful. And then there's another program, and I don't think Susan Hubner's on this call, but nurturing newborns is also, it's not a crisis nursery program, but it's sort of a kind of hybrid of that. It's also support and prevention for families experiencing really difficult life circumstances. So they need lots of support and respite early on, but mostly from children who are just coming back from the NICU, from the NICU. So giving them support. So yes, it's, if you have a question about that, whether or not your model or the population you serve would be respite, just shoot me an email or give me a call and we can talk through that.
And then following up on that, we have a question about, is this applicable to a program providing respite services to Alzheimer's clients?
I would say yes.
Oh, yes, any disability or chronic condition.
Yeah.
or special need more broadly defined.
That's that inclusiveness of the Lifespan Respite Act. So like no categorical silo services that keep people out. That's the wonderful thing about it. The challenging part of that is trying to understand respite across all those populations and all those settings. But we're really getting a good handle. And one of the things I wanted to say about those 7 criteria, they're the connective tissue between all the different models and all the populations served. Those are common to all programs. And when through this evaluation project, when I've done individual interviews with the evaluation grantees halfway through, so they're individual, and I asked them similar questions about their goals and how they went about achieving them, like what their theory was for how they were going to get this done. It was like they were reading from a script using the same language. So, and they have really different models, really different approaches, but we're discovering there's a kind of consensus about the basics that you need to do in respite to make it a really good respite program. And that's kind of exciting because we haven't had that knowledge about respite people, although you may all know it, but you know, at the state and systems level, we're discovering all the wonderful things that you do and how you think about them. I would say also an advantage to you is that you're like part of this group of really smart, supportive people across the nation who, I mean, if you ever feel like you're kind of hanging out there in your community and you want other people who understand what you're doing and support what you're doing, or you want inspiration from them or, you know, ideas from them, it's a pretty wonderful group of folks. Okay, what scares you right now about it, doing this? Anything, any worries? Any burning questions? And do you feel intimidated by anything? It's all pretty doable. And as I said, we've had, or maybe I didn't point this out, but we've had really simple models. One of my favorite models was volunteer faith-based respite program that just, you know, really operated through checklists, training, engaging caregivers to train the volunteers. And it changed the culture, actually, not only of that church and community, but other churches from around the nation started coming to learn how to do the simple model. So if you have a respite model that's pretty simple and straightforward, that's fine. We love that. Those are pretty easily and affordably replicated. So if no matter how simple or complex your model, that's not a barrier to recognition. That's something we really love and appreciate. Jill, can you think of anything I've neglected to say?
I don't think so. We did have someone ask if the recording of this webinar will be made available, and yes, it will. Hopefully by tomorrow, and we'll make sure you all get a link to the recording.
And again, if you want to reach out to me, if you need more information about anything, or you don't feel like you don't quite grasp those 7 criteria, just call and I'll talk you through that.
I put Susan's email in the chat too, if you want to read, and it's also in the slides, which I've now put a link to the slides in the chat a few times as well. So you can immediately access the slides that have all the information. And we'll also share this chat, where we've repeated all the links again. So hopefully you'll have everything you need.
I think we're good then. Any last words or questions from anyone? Okay.
We look forward to reading all your applications.
Really look
Thank you
forward
so
to it.
much.
And thanks for your time today, but especially thanks for all the work you do in your communities to provide respite. I'm a caregiver. This is personal for me. So sincerely, thank you. And yeah, we hope to learn about your programs. Okay,
Thank you.
Thank you, everyone.
bye, everyone.
Thank you.
You're welcome.
Thank you.
You're welcome.